Look down at your hands right now. Are they trying to warn you about a silent killer? Cardiovascular disease is the leading cause of death worldwide, and it often attacks silently. We are always told to watch out for chest pain, but the truth is, the body often sends out much earlier, more subtle, early warning signs of heart attack. And sometimes the most important signals lie right in the palms of your hands. Don't assume these are trivial matters. The 5 signs of heart attack we are about to discover below could be the first signs of heart attack, indicating that your heart is in trouble and that your circulatory system is not functioning well. Ignoring them could mean missing the golden opportunity to intervene before it's too late. But distinguish clearly. This article discusses the signs of underlying heart disease. It does not talk about the symptoms of heart attack in progress. If you or someone else is experiencing severe chest pain, difficulty breathing, or breaking out in a cold sweat, call for emergency help immediately. And now read on to find out if your hands are trying to save your life. Why are the hands the loudspeaker for the heart? So why must we look at the hands to diagnose heart disease? The answer is actually very simple because the hands and fingertips are some of the places furthest from the heart in the body. Imagine your heart is like a powerful water pump, and the vascular system is the network of pipes that carry water everywhere. In this system, the hands are the faucets at the furthest end of the pipes. When this pump works well, water, meaning oxygen-rich blood, is pushed to the end of the faucet with ease. But if the pump starts to weaken, which place will be affected first? It's the furthest faucet. The water will flow weakly or even just trickle. Our bodies are the same. When the heart is no longer strong enough to pump blood effectively, the hands and nails will be the first places to be starved of oxygen and nutrients. This prolonged shortage causes the distinct changes we can see, such as discolored nails, cold skin, or swollen fingertips. Those are not random signs, but direct warnings from a system that is in trouble. Understanding this, let's now look at what those specific warnings are. Sign 1: purplish or bluish nails. The first warning sign of a heart attack, and also one of the most alarming, is when your nail beds have a purplish or bluish color instead of a healthy pink. This is not the typical purple fingertip feeling when you are cold, as this color persists regardless of temperature. You can self-check by lightly pressing on the tip of the nail. If it takes more than 2 seconds for the pink color to return after you release it, is a sign that blood circulation is very poor. The reason behind this abnormal color is directly related to oxygen. Oxygen-rich blood is bright red, but after delivering all its oxygen to the cells, the blood becomes darker with a bluish-purple tint. When the heart does not function effectively, the circulation process stagnates, causing this oxygen-poor blood to get stuck in the small blood vessels under the nails for longer. Essentially, it is a direct visual representation that your body is lacking oxygen. Therefore, if you notice one of these signs for heart attack, do not delay. Consider it an urgent signal from the body and see a doctor to find the exact cause, which could originate from the heart or lungs. Sign 2: nail clubbing. The second sign is one of the strangest and most characteristic changes in shape, known in medicine as nail clubbing. Observe your fingertips closely. Do they seem larger and rounder than normal, as if swollen at the tip? At the same time, the nails, instead of growing straight, tend to curve downwards, distinctly wrapping around the fingertip, resembling the back of a spoon. There is a very good way to self-check called the Shamroth window test. Try placing the nails of your 2 index fingers opposite and close together. In a normal person, you will see a small diamond-shaped gap between the nail beds. If this gap disappears and your 2 nails touch completely, that is a very strong sign of nail clubbing. This strange change does not happen overnight, but is the result of the body being oxygen deprived for many months or even years. When the body continuously does not get enough oxygen, it tries to compensate by stimulating the tissues at the fingertips to grow, creating more small blood vessels in the hope of catching more oxygen. This process gradually makes the fingertips enlarge and become misshapen. Therefore, nail clubbing is not an emergency, but it is one of the most classic clinical signs of heart attack or disease warning of a serious underlying chronic condition, often related to the heart or lungs. If you notice this sign, arranging an appointment with a doctor for a comprehensive checkup is extremely necessary. Sign 3. Splinter hemorrhages. The third sign may seem less impressive than the previous two, but it carries an extremely important warning. It is the appearance of splinter hemorrhages under the nails. Look very closely at the nail surface. Do you see small, thin, thread-like streaks that are red, dark brown, or black? They run vertically in the direction of nail growth and look exactly like a tiny wood splinter stuck beneath the transparent nail layer. Of course, if you have just had a strong impact on your finger, such a streak might just be a minor, insignificant bruise. But the alarming sign here is when these splinters appear naturally on multiple different nails without you remembering any trauma. So, where do these blood streaks come from? They are the traces of ruptured tiny blood vessels. Capillaries under the nail bed. In cases related to the heart, the cause is often very serious. It could be due to tiny blood clots carrying bacteria that have broken off from an infection site inside the heart, usually on a heart valve. This is one of the potential causes of a heart attack or other severe cardiac complications. This condition is known in medicine as infective endocarditis. These small blood clots travel through the bloodstream throughout the body, get stuck in the narrow capillary alleys of the fingertips, and cause them to rupture, forming the blood streaks. Therefore, this is a sign with a very high warning level. If you discover them, especially if accompanied by other symptoms of heart attack or related conditions like a persistent low-grade fever, fatigue, or unexplained weight loss, you need to see a doctor immediately. Endocarditis is a dangerous heart infection that needs to be diagnosed and treated early. Sign 4. Painful nodes and flat spots on the palms of the hands. The fourth sign includes two separate phenomena that are often closely related, and they are also extremely specific signs of heart attack or disease. The appearance of Osler's nodes. Painful and Janeway lesions, painless. First are Osler's nodes. These are small, hard nodules, red or purple in color, that usually appear on the soft pads of the fingertips or palms. Their most characteristic feature is that they are very painful and extremely sensitive to the touch, even with just a light press. The second type is Janeway lesions. In complete contrast to Osler's nodes, these are flat, non-swollen spots or patches, red or brown in color, and notably, they are completely painless. They are usually found on the palms of the hands or sometimes on the soles of the feet. Despite the clear difference, painful and painless, the root cause of both phenomena is the same as for splinter hemorrhages, infective endocarditis. It is believed that the painful Osler's nodes are due to an immune system reaction to the bacteria, while the painless Janeway lesions are caused by small clumps of bacteria from the infected heart valve traveling to and damaging the skin. The warning level here is extremely high. Although rare, the appearance of Osler's nodes or Janeway lesions are classic heart attack warning signs of a serious systemic infection originating from the heart. If you discover any nodes or spots with these characteristics, this is a situation that requires emergency medical intervention. Do not hesitate for a single moment and see a doctor immediately. Sign 5. Swollen and cold hands. The final sign on our list may not be as strange as the previous ones, but it is very common and is a direct warning about the functional capacity of the heart's pump, the condition of swollen and cold hands. First is swelling edema. Do you feel that your hands are heavy tight and that rings you where daily have suddenly become snug? Try pressing your thumb firmly on the back of your hand or wrist for a few seconds and then release. If an indentation appears and remains for a few seconds before filling back up, that is the sign of pitting edema, a condition of fluid retention in the body. Accompanying the swelling is often a feeling of abnormally cold hands. This is not the normal coldness of winter, but a cold feeling even when you are in a warm room while other parts of your body remain at a normal temperature. The combination of these two phenomena paints a fairly clear picture of a heart that is functioning inefficiently, also known as heart failure. When the heart is weak, it is not strong enough to pump blood out forcefully, and at the same time, it is not strong enough to pull excess fluid from the body back into the circulatory system. This fluid gets backed up, escapes into the surrounding tissues, and causes edema. At the same time, inefficient blood pumping also means that not enough warm blood can reach the extremities, causing your hands to become cold. Although swelling can have many other causes, such as kidney or liver disease, when it is accompanied by cold hands, plus other symptoms like shortness of breath during exertion or when lying down and frequent fatigue, this is a very suspicious combination of heart failure signs and symptoms. You need to see a doctor for an accurate diagnosis and an appropriate treatment plan. Don't panic. These are common nail signs. After learning about the 5 warning signs that can be related to heart disease, it is just as important to know which signs are not something you need to worry too much about. Our bodies have many small changes, and nails are no exception. Don't rush to conclude that everything is a sign of illness. Below are a few very common nail conditions that are usually harmless or are only related to other minor issues, not heart disease. Vertical ridges. This is probably the most common condition. They are small lines running vertically from the cuticle to the tip of the nail. Think of them as wrinkles on the nails. They tend to appear more as we get older. Sometimes they can also be a sign of dehydration or certain nutrient deficiencies. However, modern medicine does not consider this a sign of heart disease. Small white spots. Leukonychia. Almost all of us have had small rice grain-sized white spots on our nails. Contrary to popular rumors, they are rarely related to a calcium deficiency. The most common cause is minor impact or injury to the base of the nail while it was forming, which you may not have even noticed. These spots are completely harmless and will grow out with the nail on their own. Brittle. Easily broken nails. A condition of weak, easily broken or split nails can be annoying, but is not usually a sign of heart disease. Common causes include excessive exposure to water and chemicals like dish soap nail polish. Remove the aging process or a deficiency in some vitamins and minerals like biotin and iron. The most important thing is to learn to distinguish between the alarming changes like bluish discoloration, change in shape to clubbing, and these common, mostly harmless features. If you discover one of the suspicious signs on your hands, the important thing is not to panic, but to act calmly and wisely. First of all, take time to observe. Use your phone to take a picture of the sign, and also note the time you discovered it along with any accompanying symptoms, however small, like fatigue or shortness of breath. This will provide invaluable information for the doctor. Your next action depends on the severity of the sign. For slow developing changes like nail clubbing or swollen hands, you should proactively make an appointment with a doctor for a comprehensive checkup, as these are signs of a chronic disease that needs to be diagnosed and managed. However, With more acute and specific signs like purplish nails, splinter hemorrhages, or the appearance of strange nodules, you should not delay and need to see a doctor immediately. It is especially important to remember if any sign on the hands is accompanied by classic heart attack symptoms like chest pain, severe shortness of breath, or dizziness, call for an emergency ambulance immediately. The purpose of this recognition is not to cause fear, but to equip you with knowledge helping you become a wise observer of your own health. Learn to listen to the signals your body sends, distinguish between common signs and noteworthy warnings. Never hesitate to seek a doctor's advice if you have any doubts, because your proactivity and understanding today are the most valuable protection for your heart in the future.